Hello everyone, Dr. Kimball here. Today I'm going to talk to you a little bit about, do you need a cervical fusion? So I'm just going to back up a little bit. When I was in training to be a neurosurgeon, cervical fusion was like the latest and greatest thing, okay? And to some spine surgeons, it's still believed to be a really great thing. But I can tell you, as a spine surgeon myself, I would do everything I possibly could to avoid a cervical fusion, okay? There are plenty of scenarios where that is absolutely the right solution for a problem. Usually patients that have spinal instability, that the joints are slipping or translating in the horizontal plane, is a good indication for fusion, although I'm doing more and more disc replacement surgery in the neck for patients that have some of this slippage, which we call, big word, spondylolisthesis. So there are some indications for disc replacement for that as well. In the past, if your doctor saw some slippage, 1 to 2 millimeters, he might have said, you need a fusion, that's gonna fix your neck pain. I can tell you that is not true. Just because you have a little bit of slippage, it could be physiologic, meaning it could be normal, you're normal. Lots of people have a little bit of slippage in their vertebrae, and that was built, they were built that way, and they've been that way forever. So just the fact that you have a little bit of slippage doesn't mean that it's a problem or that it requires a fusion, okay? Why would I want to avoid a fusion? The primary reason to avoid a fusion is that it basically changes, takes a joint that your body is created with, and it eliminates that joint, takes the motion out of it. The neck is very different than the other joints in your body. It is a complicated, mobile center of rotation. Each joint relies on the next level joint to transfer energy and transfer motion. So when you fuse one segment, you end up changing this biomechanical cascade, and you shift some energy, you shift some motion to another level. Peyton Manning had a disc fusion in his neck. He's able to do a lot of things, but I can tell you right now, I haven't looked at his spine films, he is at risk for having a problem at the adjacent levels. That is the number one reason to try to avoid fusion. If you have a problem in your neck that has been going on for a really long time, and your body has developed some severe degenerative processes that end up resulting in major spinal cord compression, or this presentation that we refer to as OPLL, or ossified posterior longitudinal ligament, that's an indication for a fusion as well. There is also a very clean indication for fusion when a patient has a true spinal deformity, okay? Outside of those spaces, cervical fusion should, in my opinion, be very, very limited, and disc replacement is probably the best option, because it's going to give the best long-term mobilization of the disc, and it's going to avoid some of these adjacent level problems. I'll do a whole nother talk on adjacent level issues, but as a patient coming in, even considering fusion or neck surgery or whatever it is, that should be the number one thing on your mind. I had a patient today that I saw that has a cervical disc herniation, and he was asking me, should we do a microdiscectomy, where we basically work through the back of the neck and just shave off a little part of the disc. And it got me thinking, 10 years ago, I would have absolutely said, yeah, you should have a microdiscectomy. But that was because our only good alternative was a fusion. Now that disc replacement technology, what we know about it, the insertion techniques and the outcomes and the reduced risk of adjacent level problems, because we know so much more and the technology's improved so much, I told them, listen, 5-10 years ago, I probably would have recommended a fusion versus a microdiscectomy. At this point, I think a disc replacement is much more durable than a microdiscectomy in the neck, for sure. And so I find myself doing less and less of that. So I'm looking for ways to avoid fusion. I'm a spine surgeon. That should tell you something about it. It's not like the devil, and it's not horrible. Some people really need it, and some people can do really, really well with cervical fusion. It can be done in combination with a surgery through the front and through the back of the neck. That's a lot of surgery. Sometimes people need that. Not everybody that gets a cervical fusion should have surgery through the front and the back of the neck. That might be a little bit overkill. And so if your surgeon is recommending both sides of the spine, having rods and screws in the back and cages and a plate and screws in the front, You might ask, well, could this all be done just through the front? Is there a way that we could do this just through the back or through the front, one or the other, or do they both need to happen? There are cases where they both need to, but you need to get educated on why your surgeon is indicating one versus another. Why are we not considering disc replacement? There are also indications to combine fusion with disc replacement. That's called a hybrid construct. Now, in the past, we might have said, well, disc replacement is very difficult to get approved at 2 levels, so we're just going to offer this patient a fusion. That's a horrible reason to get a fusion, because we're concerned that the insurance company is not going to authorize it. We do try to function in this really complicated healthcare environment, and so it is difficult, but you just need to know what you're getting into, why decisions are being made. It's your body, it's your life, and it's your mobility. So keep those things in mind. What I always tell my patients, if you are under 50 years old and you get a cervical fusion, there's almost a 50% chance you're going to need another surgery on your neck, which may be another fusion. That's very disheartening. So try to avoid it if you can, but if you fit the right criteria, then it may be the right thing for you.